And thanks for joining us tonight. I'm Dawn Sterling.
And I'm Stacy Skryzak. Tonight we begin with a story of how a Taylorville family and their friends are saving each other's lives from a hereditary kidney disease.
Our Spencer Davis shares the story of the France family from Taylorville and how their connection to each other and community has kept them alive. Spencer?
During my interviews with the family, I was told polycystic kidney disease has a 50-50 chance to be passed down. Of the 7 France family siblings, 6 inherited the disease from their father. But despite the health challenges, the family says it's something they will always face together. It's a debilitating disease that affects the France family from Taylorville. Polycystic kidney disease leaves its targets with usually 2 options for help: dialysis or a kidney transplant.
I do know that it is possible to live with this disease and never require dialysis or a transplant. That didn't work out for my dad or my siblings and myself.
Their father was not eligible for a transplant and instead suffered on dialysis. The France siblings chose the transplant route, with their donors coming from both within their family and outside of it.
I was a little girl, like first grade maybe, about that time. And I remember looking at my dad and saying, if you need a kidney, Dad, I'm going to give you mine.
Stacy followed through on that promise to her father, Bill, who lived another 17 years after the transplant. When Bill's sister, Steph, needed a donor, it was her niece, Misty, that volunteered.
I said, I'll donate, you're my family. And that's how it all began.
It's not just family members that stepped up. For Sherry McCullough, one of Steph's co-workers, a simple conversation led her to being a donor for Steph's sister, Lisa.
You know, Steph is one of my closest friends, and I care so much for her, and she was so worried about Lisa.
Dealing with the disease and transplant process can be scary. However, for the tight-knit siblings, having each other to lean on kept them going.
Bill was my only example that I could call. And Bill and I would call him frequently when I noticed something was different with what I was going through. And he'd say, oh yeah, this is that, do this.
The opportunity for a more enjoyable life, thanks to someone else's gift, clearly stays with the France family.
It's a really strange feeling that someone's willing to do that for you.
It's hard to just feel like there's people like that in this world around you. And I feel so grateful to be touched by her.
Through the ups and downs that come with the disease, the family and their friends continue to keep living their lives to the fullest. They cannot thank their family members, donors, and doctors enough.
I hope I don't cry now, I've been so overwhelmed and humbled in this whole process, because what my niece did in donating to me was give me a life worth living.
Steph, Lisa, Mike, and Bob lost their brother Bill to heart disease in 2023, but are thankful for the extra time his transplant gave them with him.
Now we bring Spencer Davis back to talk more about them and the process of receiving and donating an organ. Spencer?
According to Rachel Bounds, a certified clinical transplant coordinator, the average wait time for a kidney is about 4 years. However, with a little bit of luck and family connection, the France family was able to avoid long wait times for the 5 siblings who needed a transplant.
I think the big thing with Stephanie is that she had previous experience with transplant, with her family members having gone through it. So she had come in with a wealth of knowledge that a lot of our patients don't traditionally have.
Steph, France O'Brien, along with 4 siblings, have all successfully received kidney transplants in the last 20 years. After being diagnosed with polycystic kidney disease, she says it's important to monitor its condition.
Our disease progresses over time, like 30 or 40 years, usually, at least for the type that we have.
Bob France, who received a transplant in January of 2023, says consistent testing helped him early on.
I would get tested for my creatinine levels, your BUN, which is your blood urea nitrogen, and then also if there's a reason, they'll go ahead and do an additional test to get an EGFR. It basically tells how well your kidneys are functioning.
Once a kidney function falls below 20%, an individual becomes eligible for transplant. Then it becomes about finding a donor, which requires rigorous testing.
I remember just one of the many times I went, they took my blood, and there were, I cannot remember, but I'm not exaggerating when I say over 30 tubes sitting there.
The transplant surgery itself takes about 6 hours, according to Bounds. Sherry McCullough, who donated a kidney to Lisa France, says the procedure is also an emotional one for everyone involved.
When I woke up a little bit, the first thing I said is, is the kidney working? And they said, yep. And it's like, oh, thank you, thank you, thank you.
The recovery process lasts for months, with consistent blood work to ensure the new kidney is working properly. As for the cost, Bounds estimates the cost of the process and procedure to be $180,000.
Medicare is 80%, and then a lot of our patients, we do encourage them to have a supplemental insurance, which will cover that other 20% to buffer that. If that's not available, then private insurance are going to be just depending on what their policy states.
Costs for a donor are completely covered through the recipient's insurance. Reporting in studio, I'm Spencer Davis. Back to you.
Thank you for watching. Make sure you subscribe to our YouTube channel and be sure to watch more videos from Fox Illinois.